here. All right, so welcome again. Formally, I'll introduce myself. My name is Laura Canham. I am the recruitment and admissions coordinator and co-chair of the admissions and recruitment committee. And I am also faculty member. So I've been on the faculty here at CU since 2015. I'm also a graduate of the program. I graduated in 2011. And I have been practicing clinically ever since graduation. I work in sports medicine, and I really enjoy doing a little bit of both, some teaching, some of this admissions work, some clinical work, wearing multiple hats I really enjoy. So if you have questions from the faculty perspective, student perspective, graduate perspective, I can answer a lot of different questions from all those different realms. And then I'd like to have Amy introduce herself.
Good afternoon. I'm Amy Starrock, and sorry for the feedback in the volume.
Let me mute myself here. Where did my screen go? Here we go.
We're in the same office at the moment. So anyway, so I'm Amy Starrock and I work in recruitment and admissions. So I look forward to working with you all as prospective students and also while you're in the application process. So thanks for joining us today.
We'll get this figured out. Should be good. Sorry to those of you listening and for the feedback. We'll get this figured out. As Amy said, we're in the same office. All right, so we're going to dive in. We've got a great presentation here. I first just want to make sure everyone's in the right place learning about physical therapy. So physical therapists are really movement specialists. By the time you are done with a DPT program, you're educated to manage many body systems and work with patients of any age, within any setting, in any disease, disorder, or diagnosis. So upon graduation, physical therapists are what's considered a generalist, meaning that they could practice in any of these areas. And then should they choose to specialize in a particular area, they can do so upon graduation. So just really brief, this is what draws most people to physical therapy. They like having the ability to work with a variety of people. They also see that the job outlook is really high. There will always be a need for healthcare providers. There will always be a need for physical therapists as people are injured or if they're rehabbing some disease process, or maybe there's a progressive disease that they are now learning to live with the rest of their lives. So the job outlook is certainly high, and there's high job satisfaction as well. And largely that is because of this flexible schedule, an abundant amount of time with patients, and so much more. So these are usually sort of what we see when people say, I found physical therapy and these are reasons why I want to be PTs. These are some of those highlights. So I just want to let you all know that we have two exciting options to consider. This is a brand new sort of news release. Have those alarm bells saying news release. We just found out we have been accredited for the launch of a hybrid pathway. And so we will have next year, this is not applicable this current cycle. So for those of you that applied this cycle, you applied to the Anschutz campus, but starting next cycle, so the one that opens in the summer of 2023, we will also have an option for a hybrid pathway that would be housed at our University of Colorado Springs campus. These programs would run in parallel, and so the curriculum would be the same. The difference really would be that those that come to the residential campus would move to the Denver metro area. They would come to class every day. They would have their labs interspersed throughout the semester, and they would seek clinical opportunities throughout the city, state, and country. And then those at UCCS, they would receive their didactic coursework remotely online, and they would come to UCCS maybe 1 to 2 weeks out of every semester in order to receive the lab content. And then the clinical opportunities, again, could be within the surrounding Colorado Springs area. It could be within Colorado, and it could also be around the country. So we're excited for this new program. It will be 40 additional seats. So our current residential campus has a cohort of about 70 to 74 students. And again, the hybrid campus will have 40 seats for that cohort. So I mentioned that there's a parallel curriculum. There's also parallel resources. So when everyone is on campus, they'll have access to simulation learning, laboratories, cadaver facilities, classrooms, lecture halls, offices, and study areas. And so we, again, are just very excited for this new opportunity. Our website will have a lot more, and in the upcoming months, we'll release a lot more information as we prepare to open the application cycle. But for the sake of today, I am going to focus on the Anschutz Medical Campus for the remainder of our presentation. And again, if you have questions about the hybrid pathway, we're certainly happy to answer them. We're going to point you to the website first because we have a great FAQ page there of a lot of the basic information. And then, we can certainly field your questions as the months are upcoming as we all learn more. So I did mention again, the curriculum for both of those is in parallel, and this is an outline of our curriculum. It's a 2.5-year curriculum that starts in the summer and ends 2.5 years later in December. So we're actually graduating our class of 2022 on Friday. We're excited for their commencement. And you'll see here that we have courses interspersed throughout the 2.5 years with this wide scope. So we're covering all types of conditions. We have all sorts of research topics, interprofessional education, and more. And then you'll notice these green blocks are actually our clinical education experiences. And so this is unique to our program in that we have our students in clinic as early as the second semester. So you'll see the first sort of green block in the first fall. This is the ICE, which is an integrated collaborative experience, and I'll talk a little bit more about the clinicals, but this is unique to our program. So as you're looking for other PT programs and you're considering where to apply to, maybe you're thinking of the length of the program, maybe you're interested in what they're covering and sort of when, and maybe you're interested in when the clinical education experiences are. So some wait and have all the clinicals at the end when all the didactic has been delivered. And then others are like us that have sort of an interspersed throughout. So it's good to sort of know what's out there as well as maybe what you're most interested in. I did mention there's some interprofessional education. That's really unique to our campus. We are on the Anschutz Medical Campus, which is a health science only campus. We have, let's see, the medical school, dental, pharmacy, PA, PT. We have graduate studies, a master's in human anatomy, public health, an anesthesia assistant, and more, but all health sciences. So this is a unique campus. And because of the fact that they're all these health disciplines, we have a really robust interprofessional education curriculum. So our students actually interact with the students of these other disciplines. They're paired with groups of students from other programs where they maybe discuss some ethical scenarios or case studies, and they learn about each other's profession and they advocate on their own scope of practice so that they really can learn more about working as a team and collaborating as professionals. So that's really unique to our campus. Not a lot of programs are embedded on such a campus with such a robust interprofessional education. And then I did mention the clinical model, again, having our students in clinic early and often, and I'll go into a lot more details here on this next grouping. So any questions right off the bat just about our curriculum, the general layout, etc. And again, you're welcome to use the chat. You're also welcome to unmute yourself if you wish. So I'll pause and see if there's any questions before we move on to talking about clinical experiences. Okay. So as you saw from the curriculum outline, we have clinicals throughout, and I have it here broken down by year. So in year one, the very first clinical rotation is ICE, which is the Integrated Collaborative Experience, and that's 2 weeks in the first fall. And since it's so short, it is a local rotation. So it'd be, if you are a part of the residential cohort, it would be here in the Denver metro area. and you do not have class during any of these clinical experiences. You are in clinic 100% of the time, so you would not have class during these blocks. So the first one is that 2 weeks in the fall, and then the first independent rotation is 8 weeks at the end of that first year, so in the end of the spring. Year 2, we have a second collaborative experience followed by a second independent one, and then in year 3 is the final sort of cumulative experience, and I'll dive a little deeper into each of those. So the ICE, the integrated experience, both 1 and 2 are local, as I mentioned, because they're so short, and they are assigned. So each student is given a clinical education advisor, and the advisors help create these groups. It's usually about 4 to 5 students per group. And then they assign to a clinic here in the metro area, as I mentioned. Usually one group since there's 2 of them, usually one is to an inpatient setting and then the other is to an outpatient setting. So at the very least, with your group, you're going to 2 sort of broad general types of settings. And again, those are all embedded within the fall curriculum when you're here on campus. So then come the independent experiences. As I mentioned, each person has a clinical education advisor. And for the first one, you sort of work with your advisor on finding the best placement. And this is usually kind of based on interest as you look to map out your other experiences, and it may be based on previous observation. And these experiences could be both in state or out of state. Clinical education 2, in terms of how it's placed, students are given a sort of a master list, and they rank order their top 10. And then there's a lottery system amongst the top 10. So students are typically matched within one of their top 10 sites for their second rotation. Now for the third rotation, this is a little confusing. So I'm going to try and sort of say this a few times in a few different ways, but we have sort of 2 options. All students at the very end of their curriculum will go to clinic for 16 weeks. This is an application, and then they interview. So this is up to the student to decide sort of where they want to be, maybe setting wise, or maybe location in terms of geography. So they apply, they interview, and everybody goes to clinic for 16 weeks. Everybody graduates, everybody sort of plans to take their board exam. And then the difference between these 2 is that those who did just their clinical education 3, they graduate, they pursue their own employment, and they move on. But those that wish to stay as part of an internship will return to the same location that they just did their 16 weeks, and they will continue for 8 more months as part of a paid internship. And so the pay is less than an entry-level salary, and that's to accommodate the clinic for their mentorship time, because this is really intended for students who want additional mentorship, who are a bit nervous about pursuing their first job in their first year after graduation. And so these are students who, again, sort of want that additional sort of piece, 8 more months at the same location they did their clinical education 3. So we have about a third of our students completing this portion right now. So again, all students do 16 weeks, they graduate, they take their board exam. Some move on, pursue employment on their own. Others come back and do 8 more months as part of an internship. Now, because this is a completely personal choice, some people are ready to move on. They just want to do 16 weeks and graduate. Others are terrified of that first year. They only want to apply for sites that have the internship. And then there's a large group of people who, as they're applying, maybe they apply to both scenarios because maybe they are interested in a particular setting. So let's say somebody wants to work in pediatrics and they're going to apply to sites that are specific to pediatrics. And maybe those are both these 16-week and internship experiences. So maybe they apply and interview at both scenarios and take sort of where they're matched or what fits best for them. And so it really is an independent choice as to how people pursue this final rotation. But this again is really unique. There's only less than 5 programs that have this post-graduation internship even as an option. at least one clinical experience must be completed in a rural or underserved community. And so many of our students really do enjoy taking this opportunity to travel and be placed in a rural location. Others maybe have a need to stay in the Denver metro area. Maybe they have a family, or maybe there's other circumstances that keep them here, in which case they would be placed in at least one underserved institution, here in the Denver metro area in terms of a setting. So I'll pause for a second. Are there any questions about clinical rotations? And again, you can utilize the chat, or you're welcome to unmute yourself. All right. Zooming right along, I want to talk next about student life. And again, this is specific to the Anschutz campus. So on our campus, we have an education quad where we have buildings surrounding the quad that are interprofessional. So again, I mentioned all these other disciplines that share our campus and our resources, but we do have 2 dedicated PT labs. And within those 2 labs, they're in 2 separate rooms. We have the ability to simultaneously broadcast from one room to the other. And so we could have the course instructor in one room, sort of leading the content, maybe demonstrating, and there's cameras on, they're wearing microphones, and we have the ability to broadcast this as a live feed to the other room, and vice versa. The other room can broadcast live back. So we can have audio and visual on both rooms at the same time. Now, this really allows us to spread out. It allows us to have a better student to teacher ratio. So imagine in each room, we have lab instructors circulating, helping with some of the hands-on and psychomotor skills. And it's just a unique way to be able to teach. So you'll see here in these pictures, one is of a typical lecture hall, and then the bottom one is in our labs, where we have these plinths where we can either work in groups, or often the students are paired, where one student is playing PT and the other student is sort of playing patient, and they're going through their skills, be it examination skills or types of intervention. We also have cadaver labs, and our cadaver space is really just outstanding. I always sort of joke that most cadaver labs are in the basement, and they're dark and they're dreary, and there's the smell of the formaldehyde and whatnot. But our cadaver labs here on the Anschutz campus are actually on the top floor of one of our education buildings. There's lights and windows surrounding all of the rooms. It's very bright. The humidors where the cadavers are actually carry the air in the room down through the table into the floor. So you have, it's a beautiful experience. And we're really proud to have these cadaver labs on our campus. So what does a typical day look like? For the students on the Anschutz campus, you can expect that it's sort of like a full-time job. So you're typically on campus Monday through Friday from 8 to 5. You will always have a lunch break. And then there are days where you start early, maybe days where you days where you start later, days where you end early. Maybe you only come to campus because of a competency exam. And maybe that's just an hour out of your day and then you go home. So every week varies a little bit, but generally we tell people to treat this like a full-time job during normal working hours. Most classes are in 2-hour chunks, as our labs. Some of our labs are longer. We have, like our anatomy labs are typically in 4-hour time chunks. And then we do some sort of lab intensive days where you might have the full 8-hour day in lab, but those are usually very interactive, where you're up and moving around and participating. So when you're sitting in a lecture, you'll always have a 10-minute break in between the class, those 2 hours, and then a 10-minute sort of passing period to get to your next course. So I did mention it's really a full-time job. So a lot of people ask, are they able to hold a work or a job during PT school? So we have some students that work in flexible positions. I have here on the slide 10 to 15 hours a week. Honestly, that's a lot. I would say on average, people are working more like 4 to 6 hours a week. And maybe that's as a Lyft or Uber driver. Maybe that's as a server in a restaurant, on weekends or in evenings. Maybe that's as a nanny. but really flexible positions. So some have work study positions on campus. Maybe they work at the library circulation desk, et cetera, where student friendly hours. 10 to 15 hours is a lot. So remember, not only are you on campus from 8 to 5 as a full-time job, but then you're going home and studying and preparing for your courses throughout that week or the semester. So 10 to 15 hours really is quite a bit. Again, more typical is maybe 4 to 6. So then we always have a question about what the transition to PT school is like. And I kind of say that there's almost 2 new study techniques. One being really learning to study with other people. So a lot of physical therapy is the hands-on component. And a lot of our students have never really had that before, where you need another human to practice your skills on. And so for those of us, I'm including myself, who liked to sort of study alone, I would sort of go to a corner of the library and sit by myself and study. I had to learn to study with other people. I needed to practice. That is definitely a transition from your undergrad or your prereq courses. And then second, a lot of times in undergrad and in the prereqs, you're really studying to just take a test and move on and get through the curriculum. But in PT school, all the curriculum builds. What you learn in one semester is brought back up in the next semester, is brought back up in a year, is brought back up right before graduation, is brought back up in your clinicals, and then it's brought up in the entirety of your career. So when you're studying to retain it for the lifetime of your career, which is very different than just studying for a test where you can sort of then forget some of the content later. So definitely some new study techniques and some adjustment period. And then, I mentioned above that in addition to kind of this full-time job, we really want our students to maintain the hobbies and their other activities that bring them joy or connect them to other people. So that's where it becomes hard. Do your extra hours of the week go towards hobbies, or does it go towards work, or does it go towards family? And this is where everyone has sort of an independent choice to make. But we really encourage people to maintain balance and continue to do the things that they love while they're in school. In terms of housing, because we're an interdisciplinary and health professions campus, there's really no housing on campus. However, we have apartment complexes literally behind the parking lot. So in this picture at the bottom, right now we're looking directly down the education quad. And if you were to look just beyond that, you would see a parking lot. And we've got apartment complexes sort of to the left of where this open field is. And then the picture above is this is the Fitzsimmons 21 apartment complex in this photo. So there is housing within walking distance. So many of our students like to have that proximity and just have the 5-minute walk. Others like to have a little bit of a commute and to be able to separate themselves from campus. And so we've got 2 neighborhoods, sort of 10 to 15-minute bike ride away. We also have a light rail and bus routes that come direct to campus for those that choose to live a little further. I had a classmate who lived in Greeley and commuted to campus every day. So that was over an hour drive. So it can be done. People living all over the Denver metro area. We do have a Facebook group as well as an Office of Student Services that can help find roommates for those of you that are looking. And that could be either roommates within the program, or it could be just other students on campus. Maybe you would be a roommate with a nursing student or a pharmacy student. And so we can help facilitate connection through our student services. So any questions about student life, housing, working, etc.?
Hi, I have a quick question.
Go ahead.
For the clinicals, would the hours be the same? Would it be during that 8 to 5 period?
That's a great question. So not necessarily. When you're in clinic, you will actually follow the clinic schedule or the schedule of your clinical instructor. So maybe your clinical instructor works every day from 7 to 3. You would do the same. Or maybe they work from noon to 8 p.m. You would do the same. They might do 410s. They might do 5/8. they might work a weekend. And so you would follow with what your clinical instructor would do. And there is a process for, let's say there's a weekend that they work and you have a conflict. There are processes for sort of asking for time off and whatnot. Maybe you make it up with a different clinical instructor or a different day, but ultimately the goal is to have you follow the schedule of your instructor.
Okay, thanks.
Great question. All right, so this next portion is really to highlight the values of our program. So we really value serving our community, both locally and globally. So I'll start with sort of our service learning opportunities. So these are ways that our students can get involved and practice what they're learning in real time. So the first one here is Stout Street. This is a clinic that we have one Friday every month, where our students go to the Stout Street Clinic in downtown Denver and help treat patients who are either homeless or uninsured, and specifically with physical therapy needs. The Dawn Clinic is a interdisciplinary clinic that happens every week, and it's to serve our Aurora community here, where the Anschutz Medical Campus is housed. And this too is for patients who are uninsured. And the Dawn Clinic is really unique. I mentioned it's an interprofessional clinic. So one night a week, patients can come as sort of like a triage night. So let's say a patient comes in with chest pain, and maybe they have a team of students. Maybe there's a med student, a PT student, a pharmacy student, and maybe a nursing student. And collectively they decide, what kind of assessment do we need? Do we need any imaging? Do we need any medications? Do we need any devices for this patient? What's the best course of action? So this team of students from all the different disciplines sort of triage this patient, and there are preceptors available. This isn't, the students aren't by themselves, but any patient who is deemed appropriate for physical therapy. So let's say this patient with chest pain, turns out they strained maybe a muscle as they were lifting something, and they determined that they're appropriate for physical therapy. That patient would come back on a separate night that is just physical therapy, and where they have a full hour with a team of students and a faculty preceptor to help work them through a full physical therapy session. And so patients can be usually are followed up with maybe 3 or 4 times, it really as much as is needed. But this is, again, a unique, that sort of multiple nights a week, there's different sort of goals of this clinic. Night Owls is in collaboration with the University of Denver. This is for those that are really interested in pediatrics. This is a night where parents who have children or their siblings who have some type of disease or disorder can drop their kids off and sort of have a date night to themselves. And so the kids love hanging out with the PT students and the students from DU. Rusty Gloves is what you see in this top picture. This is a group for patients who have Parkinson's disease. And one thing we know about Parkinson's is it is a progressive disease, unfortunately. However, the progression can be delayed with some high intensity exercise. And so we have a handful of boxing clinics, I guess you could call, across the Denver metro area, where students go and host this evening of high intensity exercise. So that's called Rusty Gloves. We have a team of students who do outreach. And what this is outreach to kids in maybe middle school, high school, who we just want to let them know that physical therapy is a career choice. So a lot of people don't even know about physical therapy unless they maybe have it themselves or a family member has it. But we know that if we can let maybe middle schoolers and high schoolers know earlier that PT is a professional career choice, or an option for their future, that they may be likely to, someday apply and become part of the profession. So we have a group of students that do outreach, not only again to middle school and high school, but maybe even in our rural communities or within community colleges, and more. So the bottom photo you see here is actually on a legislative day where a huge number of students went to the state capitol on behalf of some legislative bills that were related to physical therapy. So some advocacy for the profession. So one of our other values is really having diversity, equity, and inclusion. You know, we really hope that those that come to our program have a sense of community and belonging. And we have an entire office dedicated to this, the Office of Diversity, Equity, Inclusion, and Community Outreach. And you can see here that we just really believe that diversity enhances our environment, not only educational environment, but professional environment as well. This next slide is a little busy. I'm not going to go into detail. This is on our website, but this outlines what we as a program are doing to increase diversity amongst our student, staff, and faculty, to promote inclusive environments and advocate for health equity in our community. So again, this is on our website, and you can certainly reference this later if you want to revisit this presentation at any point. And finally, our definition of diversity is actually quite broad. We're within the School of Medicine, and their definition includes everything from race, ethnicity, sexual orientation, gender identity, disability, religion, political beliefs, socioeconomic status, and it includes life experience, record of service and employment, talents and personal attributes that can enhance some of our goals moving forward. So again, this definition of diversity is quite broad because we believe that having diverse thought can really enhance our learning in clinical environments. So I'll pause here. Are there any questions sort of about some of our program values and mission as we try and serve our community and others?
One question about the outreach programs and Stout Street, Dawn, and all that.
Sure.
Are those extracurriculars that we have the opportunity to choose to do some if we're in the program, or how does that work?
That's a great question. It is extracurricular. This is totally optional. So this is students that want to do these things. They're quite popular. Stout Street usually has sort of a wait list. It's not something that usually students are able to do monthly because our wait list is long enough that maybe you're only going every other month and whatnot. So it is completely extracurricular. I will say, though, that is something to look for in other programs. So some programs, for example, do require that you complete a certain amount of maybe service-related hours. So if that's something that is really interesting to you, you know, that's something to know about programs. If that turns you off, if you're like, I think I'd be interested, but I really want it to just be, you know, something I can decide based on how I'm doing that semester and maybe something that interests me. Again, for our program, this is completely voluntary and it's per your choice. So it's a great question. And I will maybe take this opportunity to say the same about research. So some programs require you to complete a research project. And our program, while we have an abundance of research opportunities for our students, it's not a requirement. So once again, if you're interested in research, we have a lot of ways you can get involved, you know, even very minimal, just from observation to maybe data entry with a study, all the way to helping produce publications or present at a conference. But that's, again, based on personal interest. It is not required of our program. Whereas, again, some programs may require that. So just some things to think about as you're looking at PT programs across the country. Are there any other questions? All right. Okay, so a few important things to note in terms of tuition and financial aid. So I do want to make it clear, like many institutions, we have both in-state and out-of-state tuition. However, the University of Colorado is really unique in that we offer in-state tuition to our students if they have met our residency requirements. So those that are coming from out of state, if they have lived in Colorado for more than a year, they would be eligible for in-state tuition. And you'll see here sort of the tuition is broken down by credit hours. We have that divided up here. And on my next slide is sort of that cost per credit hour. So this is divided both by Colorado residents and non-residents. This is of the summer of 2022 through the spring of 2023. So this data may not reflect those that would be starting in our class of 2025 in the summer of 2023. Nonetheless, you have a sort of a general understanding. So if we were to do all the math, an in-state student would be paying their total tuition of just over $67,000. And if you are an out-of-state student who pursued obtaining residency, meaning you would pay out of state for your first year, and then you would pay in-state for your second and third half year, you would be paying around just over $97,000. These are staggering numbers, but we want to be really upfront with you with what the costs of your PT education are. And we really encourage you to ask the same questions to other programs that you're applying to, and really getting the raw numbers so that you know what it is and how that you can plan ahead. I mentioned obtaining residency. So in Colorado, that's usually 4 things. We have a residency office that would help decide what your residency date would be. But those 4 things are usually to have a permanent mailing address in Colorado, to obtain a Colorado driver's license, to register to vote in the state of Colorado. And what am I missing?
Vehicle registration.
A vehicle registration if you have one. And so once you have those 4 things, the Office of Residency establishes that date, and a year from that date is when you are deemed in state. So I want to go, this next slide is, these are the top programs. So our program, we're proud to be ranked number 13. So these are the top programs, and this is the tuition based on in-state. And you'll notice here that in-state tuition amongst top programs in the nation, and this data is a year old, so please, what I just mentioned on the last slide is obviously more than what is shown here. But nonetheless, you can still see that we're not only a top ranked program, but we have really high value considering that we're the second most affordable program. And again, this is for in-state. When we look at the same data for out of state, and again, our numbers have changed, and we can expect a bit of an increase, but as shown here from what was shown 2 slides ago, but you'll see here out of state tuition amongst the top programs that we still remain a really high value program. So to be not only top ranked, but quite affordable, we're really proud of. We're going to continue to do what we can to keep our tuition rates as low as we can. Even if there are some increases each year annually, we will do our best in terms of keeping our rates competitive and as affordable as we can. So something to consider as you're looking at other programs. And not only are you paying tuition, there's other costs to consider too. There's a cost to apply. If a program has you come interview on their campus, there's cost to travel for an interview. If you need to move cities to relocate, there's obviously a cost to that. And then there's certainly the living expenses. So as you're looking at tuition at your PT programs that you're applying to, don't only just consider tuition itself, but how much are you going to be paying for rent? How much are you going to be paying throughout the application process, and really start to do some financial planning as you look ahead. I think your future self will really appreciate if you sort of look at this well-rounded picture of your financial future. We do offer scholarships, and you'll note in this picture, we're really proud. I graduated in 2011, which means that the entire time I was in school, there was 0 scholarship dollars. And just since 2012, we've gone from $1,000 of scholarship funds to last year we had over $230,000. And I can tell you that we have more for this upcoming cycle. So we have both incoming student scholarships as well as current student scholarships. For those that are applying these incoming student scholarships, we have both the Diversity and Rural Fund. And for those, that's an application. You would write an essay that our committee would review and then select based on the application. And then we also have a merit-based scholarship where there's no application. Our scholarship committee and our program director basically select our top ranking applicants based on their holistic review. So this is their grades in addition to the entire holistic review, which we'll dive into more, basically things like extracurriculars, leadership experience, past experience, life experience, etc. So again, we're very proud that we've increased our scholarship funds dramatically just in the last decade. And hopefully that trend continues to go up and up. So any questions about tuition, scholarship, etc.?
Hi, so I had a question about the interviewing process. Is the interviewing process in person or is it like an online thing?
That is a great question. We'll dive a little bit more into the details, but I'll go ahead and answer now that for this cycle, our interviews are going to be virtual, and that's anticipated moving forward, especially with the addition of our hybrid pathway. We want to have a sort of equitable interview experience for both pathways. So the interviews themselves are one-on-one. They're by invitation only. They last about 20 to 30 minutes, and each interviewee will have 2 interviews, so with 2 different people. And they are virtual, the interviews themselves. So you can do that from wherever you're coming from. We do have the ability for some self-scheduling. So, if you need to have an evening interview or a morning interview or whatnot, we do have a little bit of flexibility for that. And this year is our first year since pre-COVID that we are offering a campus day that will be in person. So that'll be just a morning of a presentation and tours and some mingling with our faculty and students. There will be no assessment of any kind, and participation in the campus day will have no weight or influence on our admissions decisions. So all admissions decisions would be related only to the interviews themselves. And we sort of anticipate that this is how we'll move forward, is have virtual interviews and the potential for a campus visit for those that are interested to come.
Thank you.
Yes, thank you. So I have a question in the chat. On top of tuition, are there additional fees related, textbooks, materials, student activities, etc.? The answer to that is yes. And I believe, I'm not 100% sure, but I do believe that the quote I showed of numbers and cost is of tuition only. I do not believe that things like textbooks and whatnot are included in that. So you can certainly expect that there's some additional fees, and that is a fantastic question. Our website does detail a little bit more about that as what you can expect. So please refer to our website. There's a financial tab. And same thing, I highly encourage you to ask the same question to the other programs that you're applying to. So check our website for some more details regarding other fees. I'm going to hand over. Sorry, Amy and I are talking in the background, so we're minimizing as much static and feedback as possible, but I'm going to hand it back to Amy. So I'm going to go ahead and mute myself, and we're going to count to 5. There you go.
Okay, thank you, Dr. Canham. So at this point, we're going to shift gears and focus more on the admissions requirements and the application process. And as probably all of you already know, to be eligible for our program, you've got to have a bachelor's degree earned, can be in any field, and you don't have to have the degree earned before you apply, but you certainly do have to have the degree earned before you would matriculate, and matriculate just means when you would start the program. And it's I think important to note that a lot of our students are attending quarter-based institutions. And if you are attending a quarter-based school, typically a spring term will overlap with the start of our program. So a general rule of thumb is that if we have prospective students that are going to earn a degree or are taking prerequisites in that final term before our program starts, is we would say your degree has to be earned by the end of that winter. And any prerequisites that you have must be finished by that winter to make sure that everything is done by around mid-May, if that makes sense. Prerequisite coursework, we're going to go into more detail in a few moments here. And then just briefly, we do require an overall, what we consider a cumulative GPA of a 3.0. And when PTCAS does the GPA calculation for us, and PTCAS is our centralized application service, they do incorporate all previous course attempts. So if you've taken some courses and you didn't do as well as you had liked, and then you have redone them, and your institution had a grade forgiveness or repeat delete policy, please note that these are not honored in the PTCAS process. You have to report all of your grades, and then they will average all those grades when they're looking at that overall GPA. So digging in a little bit more with regard to that GPA. So I mentioned the 3.0 is the minimum, and we could potentially consider your application though, if you're between a window of 2.7 to 2.99, but the stipulation would be if your overall GPA is within that window, we would definitely need to see a positive grade trend. And what that means is the last 60 credits of college work would have to be a 3.5 or higher. And our hope is that within those last 60 credits, we're seeing very strong grades in specifically the sciences, the anatomy, the physiology, and your upper division science. And you can look at our class of 2024, that will be the class that just started this past June. Their average cum GPA was a 3.67. So it just gives you, an idea of the competitiveness of the program. And note that the GRE, while it was required in past cycles, we no longer require the GRE. And we oftentimes get students ask us, well, should I still include it in the application? And you may need to include it for other programs, but for our purposes, we're not going to be reviewing the GRE score, even if you include them, because that would not be equitable across the board. So we do not look at, and we don't require the GRE. So speaking more about prerequisites, this is the list of all of the courses we require. So we're going to require 1 semester or 1 quarter, typically of an English or writing intensive class, statistics, again, typically 1 quarter or 1 semester. And we have specific quarter-based unit numbers on our website as well. We're just using semester hours for this presentation to make it more succinct. So one semester of English, 1 semester, a quarter of statistics, and then we do require a full year of both general chemistry and general physics. And so when we say a full year, that means lecture lab components. And generally, if you're at a semester-based school, that's typically at least 8 semester hours. So typically 4 units for each sequence, the Chem 1 and the Chem 2, as well as general or college physics 1 and 2. We can accept algebra-based or calculus-based physics as well, just to note that. We do require 2 psychology courses, and we would strongly recommend developmental psychology and abnormal psychology, but you could also meet that with any 2 courses within the psychology discipline. And sometimes students have maybe a psychology-based course, like a sports psychology, that's maybe not offered within the psychology department, but it's offered in a different unit. Then as long as you've got at least 1 psychology course within a psych department, we could accept like a sports psychology as your second requirement, just as an example. Human anatomy and physiology, we require both lectures and labs, and similar to the chemistry and physics, it's typically 4 semester credits each. So a combination of lecture lab for anatomy, and then also the combination of lecture lab for physiology. And then we also accept combined courses. So there are some programs that have, for instance, human anatomy physiology part 1, and then human anatomy physiology part 2. Those combinations are also fine. Again, as long as they're at least 8 semester hours, and they do have to have lecture lab combinations. I'm going to get into more details about this upper division science, but that is the final prerequisite in our list of requirements. So drilling down into more details about this upper division science, this can get a little bit confusing, but I'll try to say this as simply as I can. So the ways in which you would meet this course would be an upper division science within the departments of biology, chemistry, physics, or engineering. And typically that upper division means 300 or 3,000 or higher. Or we can also accept a lower or an upper division course in exercise physiology or biomechanics. However, please note that for this upper division course, the biomechanics, the exercise phys, even though for the latter two courses, the biomechanics or exercise phys, we can accept lower level courses, we strongly recommend that these courses are done at the upper division. And the same is true for the human anatomy and the human physiology. We strongly recommend that those are done at the upper division. We have a very competitive applicant process. And so based on that fact, and really more importantly, to show your ability to do well in upper division courses is what's driving that strong recommendation. Okay, so the logistics of what can be pending during the application process. So you could have some courses in progress while you're applying, and we're going to get into more specifics about the timeline of the application in a subsequent slide. But just note that only one science prerequisite may be in progress during that winter or spring of that term prior to the time we matriculate students. And so for those of you that are thinking about applying this coming year, so the application is going to open in June of 2023, and you'd be applying for that summer of 2024 cohort, we're talking about that winter and spring of 2024, that only one science can be outstanding in that term. So that means everything else, your chemistry, your physics, the anatomy, physiology, all of those, except for one, has to be done by the end of that fall of 2023, if we're talking about that summer of 2024 cycle. We do require grades of at least a C. So a grade of C- or lower is not accepted for any of our prerequisites. And if you take a lower division anatomy physiology sequence, but then also take an upper division anatomy or physiology, that upper division anat or phys course can meet the upper division science requirement that I spoke about in a past slide. We also do accept some advanced placement international baccalaureate credit to meet some of our prerequisites. And if you've got questions about credit that you might have, we're happy individually to answer those questions if you want to reach out before you get into the application process. Okay, continuing the conversation about prerequisites. In that year of 2020, that spring, summer, and fall of 2020, when COVID was emerging and a lot of courses were going online, and there was clearly some transitions, we were able to accept a satisfactory or a passing grade. While we still prefer the grades to be earned during that time, we would potentially accept a pass or a satisfactory grade. Now, we may have some questions about those grades. So if you've taken a science that was a pass or satisfactory within that time frame, maybe reach out to us so we can troubleshoot any potential questions we have before you apply. However, after fall of 2020, the expectation is you're back to that standard letter grade in terms of, needing to have a minimum grade of C. The reality is, although we can accept a C, we strongly recommend that your grades are in the A to B range. Even a B- will typically say you may want to retake that course before applying, just because it's not going to be as competitive as having an A or a B grade in those sciences. And then we also have an expiration timeline to note. So the human anatomy, human physiology, and that upper division / exercise phys or biomechanics course must be completed within 10 years of the time you would enter the program. So when we're thinking about that summer of 2024 start, for instance, basically what that means is any courses that you have taken before summer of 2014 are going to be expired for our purposes in thinking about this expiration timeline. Now, although those courses have to be done within 10 years, we strongly prefer that they're done within 5 years, just so you haven't had content decay before you enter the program. So some other requirements to be thinking about. So observation hours, they're not required for the program. So we're not looking for a certain number of hours. However, we strongly recommend having as much really, I think, strong exposure to the field as you can have. And it doesn't mean that we're asking you to spread yourself thin and do 10 different, sorts of activities, but think about some ways in which you can learn about the profession. And these are, some ideas of how you can do that. And there's other options out there potentially as well. But obviously observing, shadowing, conducting some informational interviews, referencing the APTA website, listening to podcasts, observing other healthcare providers, maybe getting some experience as a PT tech or a PT aide or a certified nurse aide, just getting yourself into that patient care environment and obviously learning as much about the profession of physical therapy so you understand the expectations, the environment, and if it's going to be a good fit for your skills, your interests, and what you want in your future career. That is a really critical part of the application, is for you to show that commitment to the field. References are required as part of the application process. We require a minimum of 2 references from people that know you well, but there are some exceptions of who you may ask for the letters. So we cannot accept references from family, friends, or clergy. And, what we're typically seeing of our applicants is that professors or faculty that they've had, supervisors, maybe for employment, a licensed physical therapist that they've shadowed or observed. Those are the most common types of references we receive. And note that when you get into the application process, your application is not going to reach a verified status. And the verified status is what we're looking for you to be eligible during the cycle. All of your references need to be completed, and all of your materials, meaning your transcripts and all your coursework entry, all of it has to be complete before we even see the contents of an application. And so the reason we're telling you this now is we strongly recommend that you really start your application as soon as it launches in mid-June. And that way, if you're hitting some obstacles along the way, you've had some time to smooth them out versus waiting to apply to the last minute and then you're scrambling to get your references done or to get your transcripts submitted. And then sometimes those things are out of your control. And if you hit a certain point in the cycle and your application is not verified, you're not going to be eligible. So we always recommend starting the process early. So I'm going to pause there. Are there questions about any of the content I've just covered? Okay, we'll proceed. So we'll talk a little bit more about our holistic review process. And we have just gone through our holistic review, the first part of it for our cycle for the summer of 2023 entering cohort. And it's an amazing process because I think over the years, this holistic review has kind of been refined to really incorporate the best aspects of our applicants. And certainly we're looking at the cognitive aspects, the academic piece. But in addition to that, there are a lot of non-cognitives that we're very proud to include so that we have a better sense of our applicant pool and to look at the kind of students that we want to be part of our program. We're going to touch on each of these aspects as we're going through, but this just gives you a snapshot of kind of what we're looking at in the holistic process. So I mentioned this a little bit earlier, the rigor of courses, okay? If possible, take multiple upper division sciences in those areas that I mentioned. So the biology, the chemistry, physics, engineering, or those upper division biomechanics, exercise physiology courses are the ones we're looking for. And as I mentioned as well, we're looking for A's and B's. B minus, C plus C are not going to be courses that are going to be as competitive. We're also looking at a student's academic background. Do they have a graduate degree? Have they been engaged in research and not just participating in research studies, but actually part of the research process and maybe a co-author of a paper or a presentation as part of their academic background? Have you been a tutor, like a peer tutor in your institution, helping other students? Maybe you're a teaching assistant or a teaching aide in an anatomy class or anatomy lab. Those are the kind of things we're looking at in terms of looking at a person's intellectual curiosity. Also that positive grade trend. If you might have struggled when you first entered college, there is a way in one of the essays in PT CAS to tell us about maybe a gap or where there was a difficult time. So you do have an option to, answer yes to this, yes or no to this question of, does my GPA accurately reflect my capabilities? And if you say no to that, you give us a context to say, you know what, I really struggled in this semester because this is what I had going on. And, I think for us, we want to be able to know what happened and also what you learned from it. Maybe reflect on it to say, I went through this really difficult patch, but here's how I recovered. And here's how I learned to be a better student or understand my unique study skills that will make me successful. So we always want to look for a connection of not just what happened, but connect the dots, tell us that story of your background and how you got to where you are. Seek out community service, and, not just to show, okay, I've done these things because I'm checking a box on an application, but think about the things that are meaningful to you and that are genuine and that are going to be authentic to you as an individual. Like, what kind of things do you want in your life in terms of enrichment? And, as Dr. Canna mentioned, we are a very service-oriented program. And so we're looking for students who mirror that in our application pool. So, how can you give back to others? And we'd really like to see kind of a longer commitment to maybe 1 or 2 activities versus having 8 or 9 things that you've done just periodically, maybe like one-offs. So if you can get into something that you really find meaningful and there is this continuation of the experience, that's definitely the goal. Seek out leadership roles. And this might look like something in your employment, whether or not it's related to healthcare. Think about transferable skills when you're approaching an application. It might be that you're the president of the pre-PT club at your school. Maybe you're organizing large events as part of an organization. So, just again, think about how you can have maybe informal and formal leadership roles and how you would express those in the application process. The essays are probably the heart of the application. I can't underscore that enough. There are a couple of different essays that we'll be reviewing as part of the process. And so there's a standard PT-CAS essay that all applicants will answer. And then we have a couple of essays that are unique to our program that we're looking at in the holistic review. And we always recommend having multiple drafts. You definitely want to get your ideas on paper and then kind of work through that process, but also have others, whether it's a writing center in your institution or maybe, professionals that you work with, maybe give them these essay prompts and then show them what your ideas are, again, not for someone else to create, content on your behalf, but to make sure that you're answering the questions and that your answers are coming across in a polished way. And before we go to questions, I would just say, I mentioned earlier, connecting the dots. What we really want to see is, in your essays, in your experiences that you are including in your PT-CAS application, like, how are you connecting those experiences with what it means to be, in the application process, and more importantly, as a future potential DPT? How are you connecting? This is what I did in an experience, and this is the impact it had on me. This is why it's driving me into this profession. So we love to see those connections as we're reviewing applications. Okay, so now I'm going to pause. Okay, I think we can continue. So I mentioned PT-CAS several times. This is the centralized application for PT education. And the application will open in mid-June, and our application will close in early October. And so again, we always recommend starting the process early, and it is a lengthy application. Now, the nice thing about the PT-CAS system is you would go in, create an account, and you can come in and out of the application as many times as you need to finish the material. So you're not having to do it in one shot, in other words. So you can go ahead and start your application in mid-June, start adding programs into the system. And the beauty of the centralized application is that you could have several applications open across the US for different programs that you're looking at. And there's going to be 3 common core sections in PT-CAS that's going to be common information. No matter how many schools you apply to, it's going to be standard information. And then there's always going to be a program material section. And then that's where you hit to the heart of each school you're applying to, looking at the individual requirements and the documents that you need to provide for each of the schools that you have added to your application. And it is a lengthy process in terms of verification. And when we talk about verification in PT-CAS, what that basically means is once your application has all the components that it needs, the references have been completed, all of your official transcripts have posted, you have completed all your transcript entry. Once all that is done and you've submitted your application, then PT-CAS will determine if your application is complete and that all the transcripts are indeed there. Then they'll start their verification process, which basically takes all of your official transcripts and matches it with all of the coursework that you've entered to make sure there's not any discrepancies, that you've entered all your grades, you've correctly, that you haven't missed any schools attended, that you haven't maybe misentered a grade, that you've included all of your course attempts. That verification process can take per PT-CAS really up to 6 weeks. So when you think about the fact that our application deadline is in early October, we do allow for verifications to be happening within October. So our verification deadline is typically early November. And so, but what I'm trying to say is you don't want to wait till the very last day in October to apply that, October 1st or 2nd. We would strongly recommend really submitting no later than mid-September. Because then that gives you that full 6 weeks, provided everything's complete by mid-September, to be able to get to that early November timeline for that safe verification zone, if that makes sense. And again, as I mentioned earlier, all of your references have to be in a complete status for you to be able to get to that verification queue. Submit early. And I can't underscore that enough. This past cycle, the application fee for PT-CAS was $160 for the initial application. And then each subsequent PT program you apply for, it's another $60. So at least you're not having to pay the $160 for every school you're looking at. So you do get a discount when you're looking at applying to, more than one program. And then on top of that, $160 for PT-CAS, we also have a supplemental fee that is paid directly to CU. And I think that's in a subsequent slide here. It is, that is another $100. And as part of the PT-CAS process, I mentioned all official transcripts have to be submitted to PT-CAS on your behalf. So while you definitely need to have all of the copies of your official transcripts at your fingertips, meaning that you need to be able to reference all the courses that you've taken, whether it was concurrent enrollment while you were in high school, whether it was a community college that you attended, even if they're not prerequisite courses that you've taken at an institution, we require a full transcript entry, meaning all of your college courses have to be represented in your application. And sometimes students, maybe that have been out of their undergraduate education for a while, they sometimes forget, oh my gosh, I attended this course in the summer when I was home, and then they forget. So you really start that process now. If you don't have copies at home of all of your transcripts from all the schools attended, work on that now. Because when it comes to the PT-CAS application timeframe, you'll then need to request official transcripts to be submitted to PT-CAS on your behalf. So you're not the middle person in this exchange. You will just be the one requesting the official transcript to go directly from your schools to PT-CAS. Now, the good news is a lot of institutions partner with electronic transcript providers with PT-CAS, and that's the fastest way to get your transcripts submitted. But there are some schools that don't partner with PT-CAS for the electronic transcripts, and then they have to have paper-based transcripts submitted to Boston. So you want to just, again, add extra time to plan for these things, because at the end of every cycle, there's always going to be a student, typically multiple students, that panic and say, oh my gosh, my application is not verified because I'm missing a transcript. I forgot I attended a school, or it just took longer than I thought. We always try to be very transparent to say, we can't be keeping track of that on your behalf. It is the applicant's responsibility to monitor status, monitor when documents are getting uploaded. And likewise, as important as that is noticing when they're not getting uploaded, to try to say, oh my gosh, I asked for this transfer to be submitted 2 weeks ago or 3 weeks ago, and there's still no sign of it. So, that is your responsibility as a future applicant to make sure that you're on top of all those things. Mention the supplemental fee, that is on top of the PT-CAS fee, and the website to pay that fee is within the PT-CAS application. You'll see that when you get into the application process. Okay, so Dr. Canham actually talked about this a little bit earlier, but just to do a really quick recap, we're doing virtual interviews for the cycle, and to give you some idea of what we're looking at in terms of dates. So for the cohort that's going to enter in June of 2023, we've just sent out invitations to interview this past week, and interviews will take place that January 10th through 12th timeline. And then we'll have that optional visit on Friday the 13th in January. And the interviews themselves on the 10th, 11th, 12th will be through Zoom. And each applicant will have 2 one-on-one interviews with faculty or clinical affiliated partners. So let's talk numbers. And these are daunting, I understand. And Dr. Canham just updated these numbers in the last couple of days. So we had over 1,300 verified applications this cycle. And we had extended invitations to 266 students. We won't know until the end of this year how many students will actually accept spots, but we're thinking it'll be somewhere in the range of 200 to 220 that will actually interview. And our numbers are actually up from last cycle, where we still had kind of an enormous number of over 1,100 applications. And we honestly don't know moving forward what impact our hybrid program will have on these numbers. But this is strictly for our residential program that's been existing, for many decades here at Anschutz. And our goal is typically around 72 for the cohort that will admit for the residential program. And then the additional hybrid spots will be another 40 students beyond the 72 residential that's listed here. Okay. If you have questions, this is the best place to reach us, this pt.admissions box, because Dr. Canham checks it, I check it, and then we have another admissions staff member, Kristen. So you'll get probably the quickest answer if you send, if you want us to review transcripts, or you have questions about individual courses you've taken, or you just have general questions. This is the best place to send them, is to the pt.admissions box. Okay. I assume that's the last slide, right? Okay. Dr. Kim changes a little bit. I just want to make sure I wasn't missing anything beyond this next question. So I'm going to pause. And if you've got questions for myself or Dr. Canham, now is definitely a good time to ask us about any of the content that we've covered today.
I have a quick question.
Sure.
Okay, I'm off mute. So for PT-CAS, every transcript, no matter what, has to be submitted.
Correct.
Even if
The
it's
only
like
thing that
not
we,
even-
the only thing that we don't require is a high school transcript.
Just-
However, there was in a slide, there was a notation that if you were concurrently enrolled or it was a dual enrollment while you were in high school and you got college credit. So we have a lot of those programs here locally through CU Denver, maybe local community colleges. We are still going to require that college level transcript from that concurrent enrollment. And of course, anything that you've done post high school as well has to be included.
Has to be included. Okay. Good to know. I definitely did not know that. Okay. Yeah, thank you.
Sure, that's a great question. No other questions?